What is chronic heart failure? Hi. Welcome to Life is Good. Check the link of the article at the description. Please share and subscribe for more informative videos. Heart failure is a term used to portray the state when the heart is never again ready to keep up its capacity, that is, to keep up a sufficient cardiovascular yield to pump blood satisfactorily or to have the capacity to do as such simply because it is under so much strain that it is causing itself harm. As it were, the heart is debilitated and the pumping activity is disabled, causing heart failure. The heart does not totally come up short or quit working, as in a heart, a circumstance in which the heart really quits thumping, however rather works less adequately. Heart failure can go ahead rapidly in light of some significant occasion like a heart assault, or all the more gradually. In these moderate cases, the heart regularly adjusts to working harder and remunerates great for some time, however inevitably can't adapt and individuals begin to have manifestations. For well-being worries on heart conditions, counsel your specialist. Regular causes of chronic heart failure. Heart disease where the heart is not getting enough oxygen. Past heart assault, hypertension, diabetes, pairs the danger of creating perpetual heart failure in men and builds chance 5 times for ladies. Less common causes of chronic heart failure. Expanded cardiomyopathy, a condition where the heart just gets greater and more extensive without a known reason. Valvular heart disease, particularly aortic stenosis, where blood experiences difficulty moving beyond one of the real valves in the heart. Phenomenal causes of chronic heart. Valvular heart disease, particularly mitral and aortic spewing forth, additionally called flawed valves, where blood can stream back through them. Alcoholic cardiomyopathy, an excessive liquor can make the heart get greater, influencing it to pump less effectively. Irritation of the heart muscle, or myocarditis, incessant arrhythmias, HIV-related cardiomyopathy. A few medications, particularly the truly risky ones, can cause heart harm. Prohibitive cardiomyopathy, the heart is quit pulsating adequately by something ceasing it, which can be of obscure reason, or can be optional to infiltrative infections, for example, amyloidosis. Way of life factors influencing chronic heart failure. Smoking, obesity, abundance, liquor utilization, high salt consumption, high fat food. A few patients who have heart failure are not by any means mindful of the issue until the point that it advances to a more genuine frame, called congestive heart failure. The expression congestive alludes to a liquid development that happens when the heart gets behind in its work. Since the heart is not proficient in directing blood out, there is less blood leaving the heart and hence the blood that profits to the heart went down. These outcomes in an expansion in weight causing drainage into encompassing tissue. All the time it is at this phase, patients begin seeing indications and looking for offer assistance. Regular indications of interminable heart failure include shortness of breath on workout. While this can begin just incident with workout, in the long run it can get so terrible that there is breathlessness on simply strolling, or notwithstanding when very still. Shortness of breath on resting, orthopnea. Much of the time individuals say that they are requiring more cushions to prop themselves up during the evening, else they get shy of breath. Assaults of breathlessness around evening time that wake you up. This has the therapeutic name of paroxysmal nocturnal dyspnea. Heart palpitations where you can feel your heart pulsating in your chest. Loss of hunger, acid reflux, sickness and spewing. In the event that chronic heart failure gets awful, liquid can develop, prompting swollen feet and lower legs. Clinical examination of chronic heart. On the off chance that a patient present with manifestations that could mean endless heart failure, at that point they will need to inspect loads of various frameworks of the body. Right off the bat, parcels can be learned just from general assessment of how agreeable a man is by their rate of breathing and their heart rate. This is particularly critical on resting, as in unending heart failure shortness of breath is typically exacerbated much when laying level. Next, they might need to inspect the patient's neck veins, as they can give data about how the correct side of the heart is working, and can indicate whether any blood is being pushed once more into them because of defective heart valves. After this, the specialist will need to inspect the patient's chest where now and then the beat of the heart can be seen through the chest divider. This can give a thought with reference to how enormous the heart is and where it sits in the chest. They will then need to tune into the heart, which can give data about bloodstream and furthermore about the valves. The specialist will then need to tune into the lungs. This is on the grounds that in unending heart failure, liquid can develop behind the left heart and begin pooling in the lungs in a condition called pneumonic edema. This liquid makes little crackles called crepitations that can be heard with a stethoscope. Examination will then move to different regions like the liver, which can end up noticeably extended and delicate in perpetual heart failure. This is a direct result of the weight developing on this side of the heart and blood not having the capacity to leave the liver, and it should. The specialist will likewise need to check with the expectation of complementary liquid called edema in zones that it is probably going to deplete to, for example, your lower legs and back. This edema liquid develops in light of the fact that the blood is not being pumped effectively through the heart. This causes a great deal of weight in the veins that bring blood back towards the heart, driving liquid out of the veins and into the tissues. How is chronic heart failure diagnosed? There are heaps of tests that a specialist can do in ceaseless heart failure. These tests can be utilized for diagnosing the condition and in addition working out exactly how extreme it is. In the first place, the specialist might need to do some blood tests to keep an eye on kidney work, liver capacity, thyroid capacity and the measure of cells in the blood. There are additionally two hormones found in the councils of the heart called ANP and BNP. These are discharged when the heart is extended, as occurs in unending heart failure, thus these can likewise be tried for. Next, the specialist might need to work out exactly how much exercise and action a patient is able to do. There are a few tests for this. 6-minute walk. A 6-moment walk test includes strolling a roundabout track of 25 meters the same number of times as is conceivable in 6 minutes. On the off chance that a man begins strolling less and less each time, then it is a sign the ailment is deteriorating. Exercise testing. This includes getting on a bicycle or treadmill and working out how much exercise a man can do. There are likewise some different sorts of particular tests that might be done if the specialist thinks they will be useful. Electrocardiogram (ECG). This measures the electrical movement of the heart and can give bunches of data about any variations from the norm. Chest X-beam. There are bunches of changes in a X-beam that are caused by heart failure. Echocardiography. This resembles an ultrasound of your heart, and can give data about blood streams and the capacity of the valves. Coronary angiography. This includes setting some color through a little tube into the heart vessels and seeing where the color streams to, giving a smart thought about blood stream to the heart. Atomic cardiology. Nuclear sweeps, for example, cardiac PET can give some helpful data about blood stream to the heart. Spirometry. This test checks how well the lungs are functioning and can prohibit different reasons for windedness, particularly in smokers. How is chronic heart failure treated? There are a few techniques for treatment that intend to enhance both the indications and life expectancy of those misery from constant heart failure. Way of life changes in chronic heart failure. Enhanced diet and weight loss. This will enhance both exercise resilience and personal satisfaction. Lessening in soaked fats is especially essential in the individuals who have poor bloodstream to the heart. Exercise is especially imperative in somebody with cardiovascular failure. Some of the time, the yield of the heart can be so awful in ceaseless heart failure, that very little blood gets to the gastrointestinal framework, and this can prompt obstruction, so high-fiber eating methodologies are normally suggested. Additionally, if a major supper is eaten, then a considerable measure of blood is required in the digestive organs to take every one of the supplements away, which implies that it is occupied from different parts of the body. This can prompt so little blood. How does fiber protect your heart? What is fiber? There are two types of fiber, soluble and insoluble, but most fiber-rich foods contain some of both. It is also considered either dietary or functional. The dietary kind of fiber is the indigestible part of plants that we eat, like vegetables, fruits, whole grains, beans and nuts. This is obtained naturally from whole foods. The functional kind of fiber is extracted or prepared in a lab. It's the type of fiber that is found in supplements or fiber-enriched foods. Experts say that it's best to aim for a balanced diet rich with plenty of fiber-laden foods. According to them, it is the whole pattern that seems to have an effect, so it is hard to pick out exact foods, as food as a complex thing. Heart health perks. Fiber is mostly associated with a healthy digestive system, but research has shown that it can do a lot more than just keep you regular. Scientists are still trying to figure out how exactly fiber works in the body. Some ways by which it helps your heart are given below. Lowers cholesterol. Soluble fiber reduces both bad LDL and overall cholesterol by binding with cholesterol particles in the digestive system and by driving them out of the body before they are absorbed. Protects against strokes and diabetes. Stroke and diabetes lead to an increased risk of heart diseases. Fiber-rich whole grains lower the risk of a stroke by up to 36% and the risk of type 2 diabetes by up to 30%, as per research. Reduces blood pressure. In another study, researchers put some people on a high-fiber diet that included lots of whole wheat and whole oats. After 12 weeks they found that the participants had a drop in blood and pulse pressure. Encourages a healthy weight. Fiber can also become a weight loss weapon as it keeps you full by staving off hunger for a long time. Longevity. All these benefits add up not only to better heart health but also to a longer life. In a study, researchers had observed a group of people for 9 years. They came to this conclusion that eating lots of fiber lowered the risk of early death among men and women. Experts say that women under the age of 50 years must get about 25 grams of fiber a day and men must get about 38 grams of fiber. Knowing how fiber guards your heart, you must eat a balanced diet comprising of fiber-rich foods like whole grains, beans, nuts, fruits and vegetables and other nutrients on a regular basis to stay healthy always. Please share and subscribe for more informative videos. Have a prosperous and wonderful life.